Introduction. Welcome to today's lecture on pleural plaques, a topic of great significance in the field of pulmonology. Pleural plaques are a pathological entity resulting from asbestos exposure, and understanding their anatomy, pathophysiology, diagnostic methods, clinical features, and management is essential for healthcare professionals. Throughout this lecture, we will explore the various aspects of pleural plaques in detail, enabling you to develop a comprehensive understanding of this condition. So, let's delve into the fascinating world of pleural plaques. The pleura is a membrane that lines the chest cavity and covers the lungs. It consists of two layers, the visceral pleura and the parietal pleura, separated by a thin layer of fluid. This structure helps facilitate smooth breathing and protects the lungs. Pleural plaques are linked to asbestos exposure, occurring mainly in those working in industries that use asbestos. Risk factors vary across populations, affected by intensity and duration of exposure, as well as regulatory measures. Understanding these factors helps assess the impact on different populations. Pleural plaques develop due to the body's response to asbestos fibers. Macrophages engulf the fibers, but they accumulate over time, causing chronic inflammation and fibroblast proliferation. Collagen deposition results in plaque formation. Understanding these mechanisms helps identify potential treatments. Accurate diagnosis of pleural plaques is crucial. Chest X-ray is the initial screening tool but has limitations. Complementary CT scan and MRI enhance visualization and facilitate accurate detection and characterization. Integrating different diagnostic methods is essential for a comprehensive assessment. Pleural plaques often manifest as asymptomatic or with subtle, nonspecific symptoms. Many individuals remain completely unaware of their presence until incidentally detected on imaging studies. When symptomatic, common complaints include mild chest discomfort or occasional shortness of breath, which are usually attributed to concurrent respiratory conditions or aging. Physical examination findings are often normal, but decreased breath sounds or pleural friction rubs may be observed in certain cases. Considering the varied presentation and frequently asymptomatic nature of pleural plaques, it becomes crucial for physicians to maintain a high index of suspicion and correlate clinical findings with imaging results. Distinguishing pleural plaques from other pleural diseases is challenging. Clinical, radiological, and pathological evaluations aid in accurate diagnosis. Pleural thickening, pleural effusion, and malignant pleural mesothelioma share similar features. Integration of assessments is crucial in the differential diagnosis. Histopathological examination of pleural tissue samples is often crucial in confirming the diagnosis of pleural plaques. Microscopic evaluation reveals characteristic findings, including collagen fibers arranged perpendicular to the pleural surface and varying degrees of fibrosis. Calcified nodules may be observed within the fibrous tissue. Pleural biopsies obtained by thoracoscopy or during surgical procedures allow for a thorough examination of the pleura, aiding in accurate characterization of the lesion. Ancillary techniques such as immunohistochemistry may be utilized to exclude malignant mesothelioma, particularly in challenging cases. Understanding the histopathological characteristics is vital to provide a definitive diagnosis and guide further management decisions. Differentiating between asbestosis and pleural plaques is crucial due to their distinct clinical, radiological, and histopathological features. Asbestosis causes diffuse fibrosis in lung tissue and restrictive lung disease, while pleural plaques primarily affect the pleura. Recognition of these differences aids accurate diagnosis and management. Obtaining a detailed occupational and environmental exposure history is crucial in establishing the diagnosis and managing pleural plaques. Identifying the specific industries, professions, and duration of asbestos exposure plays a significant role in attributing symptoms or disease to occupational exposure. A thorough history allows for targeted surveillance and adoption of preventive measures to minimize further exposure risks. Furthermore, documented occupational exposures become essential in medico-legal contexts, such as compensation claims and identifying responsible parties. Thus, recognizing the value of a comprehensive occupational history is vital in managing pleural plaques effectively. Pleural plaques can have long-term consequences, including impaired lung function and increased risk for other asbestos-related diseases. However, prognosis is generally favorable with proper surveillance and management. Close monitoring is necessary to detect complications early. The presence of pleural plaques